Hi everybody. So I'm going to take about 20 minutes to give you a bit of a whiz through the kind of picture that we're facing in Oxfordshire at the moment, a bit of a whistle-stop tour. So forgive me that this is going to be done at some pace, but what I was asked to do was just to kind of present a quick picture of the situation in Oxfordshire at the moment, particularly in terms of needs of some of the more vulnerable people in the county. So I'm going to go through this quite fast. There is quite a lot of information on some of the slides, and I appreciate it's a small screen and some of you are quite a distance away. So I'm very happy for the slides to be circulated afterwards if you'd find that useful to see a bit more detail. So the first thing just to flag is that the County Council, jointly with particularly health partners in Oxfordshire, produced something called the Joint Strategic Needs Analysis, JSNA, people sometimes call it. It's available on the County Council website, and it sets out in immense detail information about several hundred indicators in Oxfordshire, down to quite local levels. So if you're interested in your own local picture in terms of data, and what are the issues around children, young people, vulnerable adults, older people, actually it's a very, very rich resource that you may find useful to know about. So that's just a snapshot of the website. So starting off with the population of Oxfordshire, 678,000-ish, based on the last census in Oxfordshire. And what you've got here is the pyramid of how the population has changed between 2005 and 2015. People who can't see it well, essentially you're seeing a growth in the number of people who are newly retired, so the sort of 65 plus age groups, and a decline in population among those aged between about 35 and 44. People, I'm sure, will be well aware that the housing needs in Oxfordshire are immense, and there are a lot of plans for new housing coming right across the county. And that will mean a rapid increase in population. Population's already growing quite dramatically, but actually, if the 100,000 houses that are being planned for to be built between 2015 and 2031 are delivered, then you'd expect to see the population rising to 864,000 by 2030, which means an increase in nearly 30% of our population. That's more than double the growth that you've seen over the last 15 years, so between 2000 and 2015. So really a lot of potential for very, very significant growth. Just going to talk briefly about older people and more vulnerable adults in the county. So, as is the case nationally, we're seeing increasing numbers of people who are older, but particularly those who are the most elderly in the county. So the past 15 years, we've seen a growth in those aged over 85 of about 27%. Over the next 15 years, we'd expect the percentage increase to be nearly double, so about 100% increase in those aged over 85. Leading causes of death in the county, cancer is currently the leading cause of death, but you see some interesting increases in particularly causes of death relating to dementia and Alzheimer's, and actually some declines in issues like heart disease. For the County Council, we have an important statutory role around supporting vulnerable adults, and particularly older people who need our help. And the increase in dementia cases is really striking and will continue to grow as we expect the population to carry on ageing. So one of the services that we provide is adult social care services, and for people who can't see the detail of the slide, rapid growth in numbers of people needing support from the council in terms of adult social care. So this is primarily older people, but not only older people, also adults with learning difficulties and physical disabilities. But in 2012, we supported about 3,000 people who were in the older clients, and by 2016, that's gone up to over 4,000. So really significant increasing demand for our services. And that's all come, of course, at a time when local government funding has been declining very, very rapidly, And so we've seen the kind of classic squeeze around demand for the most expensive services for the most vulnerable older people increasing rapidly at the same time that our ability to fund that need has declined. And partly that has led to an increase in people that we try and support at home. So it's partly to do with funding reasons, but also partly because actually, as I'm sure many of you know, it's far better for people to be staying at home for as long as they can, keeping mobile and well and looking after themselves. So we've seen very big increases in proportions of that client group who are now supported at home by the council as opposed to coming into some formalised care. Again, just as you hear on the news at a national level, we see increasing issues around mental health issues in Oxfordshire. And that's particularly stark in women, but also increasing in men. And I thought this fact about the number of people who are diagnosed with depression, this is from the CCG, the Clinical Commissioning Group, so GP data, increased by 19% in just 1 year. So between 2014-15 to 2015-16, the number of people being diagnosed with depression increased by 19%, 50,000 people in Oxfordshire. Children and young people, Colin referred to the schools landscape earlier, and I'm sure all of you will be aware of the kind of complexity of that landscape, both locally and nationally. And in Oxfordshire, we have a relationship with about 300 schools, so about 230 primary schools, and then many secondary schools and other types of schools that are now in existence, and work closely with the Diocese and others in that landscape. Huge numbers of almost all of the secondary schools are now academy trusts or part of academy trusts, and a very complicated landscape in terms of the primary sector as well. Another very large service area for the County Council is around children's social care. You probably can't see the data here, the detail of the data, but essentially what you see is a number of lines going up. You've got time along the bottom and lines going up. Those lines show the rising demand for services around domestic violence, children who are subject to a child protection plan, children going missing in Oxfordshire, and children who are being looked after by the local authority. And really, the kind of key thing to note from this is not the detail, but it is the extent that the demand for all of those things are increasing over time. Since, over the last 4 years, we've seen a 60% increase in children who are being looked after by the local authority. That is absolutely dramatic. In fact, it outstrips the national picture quite considerably. So possibly we were lower than we should have been previously, but we are now actually putting more children into care than similar areas across the country. So some really challenging things for us locally about what we do about that, how we work with partners to try and keep children safe at home, if at all possible. Again, you don't need to see the detail of this slide to understand the point I'm trying to make. So you've got two maps here. This is the county. The darker colours show an increased prevalence of different things. And they look like they are exactly the same maps. When I first saw them, I thought somebody had repeated the same map twice. Actually, they're demonstrating different things. The map on the left is showing referrals to children's social care, and the map on the right is the number of incidents of domestic violence that are reported to the police in a particular location. And what you see is really an absolute clear picture that the children that we're worried about being most vulnerable are located in the same areas as where the police are seeing a lot of reports of domestic violence. The point I was trying to make here is that we're working with the same vulnerable families time and time again. Different agencies are working, with the same people. So we need to focus at a very local level at joining up with partners, and we are doing that. But I think it just demonstrates the kind of complexity of the picture across Oxfordshire and the intense pockets of need that exist in different parts of the county. For people who can't see, the red blobs are focused primarily in the southeast part of Oxford City, in areas of Banbury, and then in the south of the county, particularly around Berrinsfield, I think that is. I've mentioned safeguarding already. The County Council is a key player on the Oxfordshire Safeguarding Children's Board, and a lot of the work that we do relates to safeguarding. The words on the slide just demonstrate some of the complexity of the issues that we deal with, and that I'm sure you will be kind of aware of in your everyday work. But issues around neglect, abuse, child sex exploitation, preventing extremism, drugs and alcohol, mental health issues, suicide, self-harm, bullying, parental substance misuse, domestic abuse, and female genital mutilation are all very, very live issues in Oxfordshire for us, not only for the County Council but for partners, and obviously working very closely with schools and health colleagues particularly. Okay, so to change the subject onto something much bigger, thriving economy. I don't know how aware you will be of absolutely how buoyant the local economy is in Oxfordshire. Oxfordshire is truly a kind of globally significant economy. We've got about 30,000 businesses, really got full employment, very, very small numbers of people who are unemployed. And in fact, one of our biggest challenges in the public sector is that we cannot get the workforce we need, particularly to do those jobs around caring for more vulnerable people. And that plays out whether it's the health part of the public sector or the social care part of the public sector. It's a massive risk for us. The Oxford area, so not just Oxford itself, but the kind of area going down towards Didcot and up towards Bicester, is among the top 5 technology innovation ecosystems in the world. So 1,500 high-tech companies employing 43,000 people. We're really globally significant in terms of the spin-outs from the universities and how they've now been developed in terms of very successful companies doing globally significant science. The county is one of the very few areas of the country that actually makes a net contribution to the Treasury. So we're absolutely a global, we're a driving force of the national economy. And we're growing really, really fast in terms of our rate of economic growth. So last year, Oxfordshire, which is, there's something called local enterprise partnerships that the government has set up across the country. Oxfordshire's boundary for the local enterprise partnership is the county boundary. We were the fastest growing local enterprise partnership area of anywhere in the country. And on all measures, we're right up there in the top 3 or 5, sometimes beating the Greater London area, sometimes just behind that. And jobs growth is phenomenal, despite the fact that housing is such a challenge locally. And I've got a slide in a minute to show the issues around house prices. Actually, that doesn't seem to be slowing jobs growth. People want to work here and they are coming here, and whether that involves travelling great distances or finding the money to be able to afford to live here somehow. Jobs growth increased by 11.5% between 2010 and 2015. And the ambitions that the Local Enterprise Partnership has for jobs growth, which was 85,000 new jobs to go alongside those 100,000 new homes, well, actually, we're way above trajectory for delivering those jobs locally. So, really interesting. Having said that, we think it's clear that actually Oxfordshire could go quite a lot further in terms of comparisons to some other areas. So, actually, our wages are below, they're above national averages, but they're below some other places in the country. So London and Berkshire, for example, have higher levels of wages than we do locally. That's just a slide that shows a bit more of the detail around wages in Oxfordshire. But really the point is that unemployment is very, very low and earnings are relatively high. But of course, despite that kind of big picture positive story, actually income deprivation is a major issue in some urban areas and across rural areas of the county as well. So we think that there are 13,500 older people in Oxfordshire who are affected by income deprivation, and they're split both between the more urban areas and the more rural areas. It's not right to assume that all the deprivation is in the more urban areas of the county. Absolutely spread. Sometimes it's harder to see the rural deprivation, but it's there. And children in poverty, there are about 141,000 children in Oxfordshire And we think about 14,000 of those children are affected by income poverty, which are primarily in the more urban areas, so 81% of that in the urban areas and about 20% in the more rural areas. This slide, sorry, you can't see it well, but this is a slide that's based on data showing deprivation, and the darker colours, so the bits hopefully you can see, the red patches are the more deprived areas of the county. I'm sure you all are well aware of the housing price issues. Oxford City and South Oxfordshire are the most expensive places to buy a house relative to earnings in the country. So really stark, and it's getting worse. This slide, if I just take a minute to explain it, shows in 2001 across the different districts, this is the slide on the left-hand side, which is green. In 2001, if you were having an average income for your area, how much beyond the average income you needed to be earning in order to be able to afford an average house for that area. In 2001, across the districts in Oxfordshire, it was between about 1.3 and 1.6 times your average earnings in that area. In 2016, which is the chart on the left, you're right, that has increased to between 2 times and 3 times your average earnings. So in order to be able to afford a house in Oxford City, an average house in Oxford City, people's incomes need to be 3 times the average income level that exists. It's slightly complicated, but hopefully makes some sense. I mentioned already that there's very, very significant growth going on across the county, and you'll, I'm sure, have seen parts of that in your villages and local towns and the impact that that's having on infrastructure across the whole place. So massive challenges around roads, rail, making sure that housing and jobs are connected in a sensible way, and essentially making sure that plans for the future, with that really big increase in housing expected, that it's being managed in a joined-up way. So this just shows some of the particular areas of pressure that we know growth is likely in, and the County Council, along with the District Councils, working together to create an infrastructure plan and putting in very large bids to government for funding to make sure that those infrastructure requirements are funded and delivered, because otherwise there will be a break on that whole economy, and we will grind to a halt. Finally, this is my last couple of slides, Oxfordshire's communities, and I feel very much as though you're the experts in Oxfordshire's communities, not me, but I think you will be really well aware of the kind of very strong nature of communities in Oxfordshire. So we've got Oxford City right at the heart of the county, but obviously a number of largish market towns all doing very well, and over 300 villages in the county. It's the most rural county in southeast England. And we've just done a survey of residents locally, and I thought one of the kind of key things I got from it was that 89% of people tell us that they're satisfied or very satisfied with where they live, in their local place as an area to live. That's really stark. That's very significantly above other places that ask the same question and above what you get nationally. So there's this very strong sense of we like where we live, and actually I think you see that in terms of the way that people are very active often in their communities, high levels of engagement in local democracy, and often doing an awful lot in local communities around volunteering, helping others, working with all of you, I'm sure. There are 4,500 voluntary and community organisations in the county, and Colin chairs, along with the County Council, a group that tries to support and enable that sector to continue to flourish and to grow. So we think a lot about that. And a real key theme for the County Council at the moment is how do we help communities to help themselves? And in part, that is a consequence of the fact that we have far less money than we had a few years ago, and we can't afford to run all the services ourselves that we used to run. But in part, it's because actually, I think there's good evidence that people who are doing things for themselves are far more able to meet local need than a kind of top-down system of us providing services in a particular way. So finally, I thought I'd just end with what the County Council is trying to achieve in Oxfordshire. This is our vision. So we want thriving communities for everyone in Oxfordshire. I won't read it all, but essentially it's about our role in enabling thriving communities, enabling thriving people, including very much focused on the most vulnerable, and supporting that thriving economy that we've already got and is not going to go away. So we need to make sure that we're enabling it to grow in a way that works for the local environment and for those local communities. That's it.
Thank you.